If the manufacturer is not able to supply the one, then you can actually use this one. Welcome to the weekly dose of self-care, presented by your neighborhood pharmacist. Today, we're going to talk about part 2 about how to treat an ear infection without the need to see a doctor. Some signs that you have an ear infection may include ear pain, difficulties hearing, there's a feeling of pressure or fullness inside the ear, and if a baby has ear infection, one of the easier signs to identify it is that they will start tugging their ear. Not all ear infection needs to be treated. So technically, as long as you're greater than 6 months old, our body should be able to fight off the infection on its own. Usually, the time window is 3 days and there's no improvement, then you go see the doctor. But before you do that, you need to make sure that your symptoms are mild, in the sense that if you have a fever, it is less than 39 degrees Celsius, and that the ear pain that you may experience is considered mild, then you need to know what is considered worsening of symptoms, so you can see the doctor when appropriate. After you make sure that you don't have any severe symptoms, then you can try the over-the-counter Polysporin for ear infections. So this is the blue one. It contains 2 ingredients. The first one is polymyxin, and the other one is lidocaine. So polymyxin is an antibiotic to fight the infection, while lidocaine is there to help numb the ear pain, since ear pain is a common symptom of an ear infection. In terms of how to use it, it's going to be 3 to 4 drops into the affected ear 4 times per day, and you do it for at least 7 days. To make sure we are getting the maximum effect from the ear drop, we have to make sure our ear canal is open and straight. In terms of how to get to that right location, it depends on our age. So if you're greater than 3 years old, you gotta pull the top of the ear up and back. Or if you're less than 3 years old, you gotta pull down your earlobe, down and back. By doing this, you'll be able to open up the ear canal. And that's when you would put in the ear drop into the affected ear. So again, it's going to 3 to 4 drops. And after you put it in, you gotta stay in the same position for 5 minutes. If both of your ears are infected, you have to wait 5 minutes in between and put it into the other ear. After you use the ear drop, you should be able to see improvement in 3 days. If there is no improvement, then you gotta see the doctor. It is very important to remember that even after your symptoms improve, you still gotta put the drops in at a minimum of 7 days. The reason for this is that if for some reason there are some bacteria that survive but not able to cause an infection, these bacteria who have survived are able to start evolving and develop resistance to antibiotic. So that the next time when you use the same antibiotic again, then it will not work for this kind of infection anymore. If you have ear pain that comes with the ear infection, then usually there are 2 choices, either Tylenol or Advil. Advil might be a better option because it will help with inflammation as well as pain. But sometimes when people get sick, they typically don't drink enough water or eat enough food. In that case, Tylenol will be a better option to use for the pain instead. If you recall from a previous ear infection video, I talked about the Polysporin for the pink eye. Now you might wonder, is the one for the pink eye the same for the ear infection since it both says Polysporin? Technically yes and no. So the Polysporin for pink eye has 2 antibiotics, while the one for the ear infection has 1 antibiotic plus a numbing agent for the pain. So if there were any situation in which that the manufacturer is not able to produce the blue one for the ear infection, then technically you can actually use the one for pink eye to treat an ear infection instead.